At home base, we provide very individualized and custom treatment plans for everybody that we see. From the initial phone screening that we do with them all the way up and through the end of their time here, we're constantly adapting and adjusting their plan based on what they're telling us they're struggling with and what they need. Everybody that comes to the 2-week intensive clinical program has their own personal care team. So that includes their individual therapist, their medication provider, their case manager, and then they have nurse case managers available to them as well. Those people are meeting regularly to make sure that we are meeting the needs of what that service member is struggling with. We also sometimes add on additional services based on what their symptoms are. So for example, we might set someone up with substance use consultation or parenting consultations as well. We always want to make sure that we're really looking at the whole person. So that very much includes customizing the care as it relates to their family members as well. We provide case management services for their family members. And so it's pretty common that we'll work with people to get couples counseling or family counseling set up for them after the program as well. It takes a lot of people to be able to provide the gold standard care that we deliver. We want to make sure that we are customizing the care that people need. So every person that we see is complicated and has different things that they're managing. No one can perfectly fit into one mold or one size fits all. We want to make sure that we are really understanding both the history and the current presenting concerns of every veteran, service member, and family member that we see. Therefore, we want to make sure that our team is full of specialists and multidisciplinary staff to be able to meet their needs, whether they are related to their mental health, their physical health, their family concerns, their substance use concerns. And so we ensure that our staff is full of people who carry all of those expertise with them. There is no more deserving population than those that they have allowed us to lead for ourselves. So we want to make sure whatever that looks like, whether that is mental health care, financial assistance, housing assistance, we want to make sure that we pay it back, essentially, because we're all able to lead the lives that we want because these men and women have served and have made massive sacrifices for us.
BrainLine is powered in part by Wounded Warrior Project to honor and empower post 9/11 injured service members, veterans, and their families.